Hello and Assalamu alaikum. Multiscan Diagnostics. Say this is the CBCT of the patient that you had requested. Now focusing on the upper arch, you can very clearly see that we've got very limited bone in the upper arch. We've got starting with the upper right posterior. As you can see, there's an orovantral communication also here, very clearly seen right here. And then moving towards the anterior region, we see very nice effects. So the upper arch definitely cannot support any implant until solid bone augmentation is performed. Moving to the lower anterior region, starting with the lower right side, this is where we have slight bit of bone in the central incisor region, 5 millimeters of ridge width with approximately 11 millimeters of height. Moving to the canine region, we've got again a BDR present here, ridge width of 9 millimeters and a height of approximately 9 millimeters as well. Moving to the lower right premolar region, again very limited bone. When this comes out, you'll have 7 millimeters of width with 12 millimeters of height and a buccal defect. This is the 5 region. Again, we've got 6 millimeters of width with 9 millimeters of height. Very limited bone in the 6th region because of the shape and the height of the mandible. Just 5 millimeters of ridge width with approximately 7 millimeters of height. Lower left central, you can see you've got a periapical radiolucency, 6 millimeters of width with approximately 11 millimeters of height. The lower left canine region again has a periapical radiolucency, quite severe if this tooth is extracted. 8 millimeters of width with approximately 12 millimeters of height. And then premolar region, you've got no buccal plate, so hence implant placement will be difficult. And in the region of the 5 and the 6, you've got very thin ridge, and hence implant placement is going to be a challenge. 4 millimeters of width with just 10 millimeters of height. This is how the tooth looks from a axial point of view. There you go. Going to Now, axially, you can see that this is the lower arch, very thin bone with buccal defects, especially on the left hand side. And then this is the upper arch. You can see there's absolutely no bone present for any implant placement.